Well, thanks for staying with us. The World Health Organization, with partners and communities, is today commemorating the World AIDS Day with the theme, Let Communities Lead. The WHO is optimistic the world can end AIDS with communities leading a wider response to HIV control. In this next report, senior correspondent Jacqueline Ogoh tells of how the Lagos State government is creating more awareness. All right, for more on this, let's bring in our guest. He is the Vice President, Medical Initiative for Africa, Dr. Agbo. He joins us live via Zoom from Abuja. It's good to have you join us on this special day.
It's a pleasure to join you. Thanks for having me.
All right, let's get into the conversation now. What, in your own opinion, makes today pretty significant?
Well, every 1st of December is commemorated as the World HIV/AIDS Day because it gives us opportunities as co-partners in the fight against HIV/AIDS to bring to bear issues that are probably undermining the fight and factors that we can improve upon to achieve the goals that we aim to achieve. As it is now, 2025 is fixed, is the target year for achieving what we call the 95-95-95 goal, meaning that 95% of country population who are HIV positive should be aware of their status. 95% of those people who are confirmed HIV, it should be put on medications which are life-saving, and 95% of those on medications should achieve what we call viral suppression. That means a viral load of less than 20 copies per mil. It is said that we know from research that at that viral load, transmission is theoretically very, very unlikely. So these are all critical components in mitigating the impact of HIV/AIDS on the population. Based on estimates, we know that about 1.9 million Nigerians have HIV, and a high number of that percentage, 1.63 million, are on life-saving antiretroviral drugs, which would enable them to achieve significant viral suppression and to live a normal life. It would also increase the ability of programs to achieve targets of cutting on new infections, especially mother-to-child transmission, which Nigeria contributes about 30% of global burden, meaning that every new infection that a child gets from an infected mother, it's a significant setback. So on days like this, we tend to discuss the issues that can drive us towards the target goal. And by 2030, it's expected that we should completely have a zero new infections and zero
AIDS. Yes. The question I'd like to ask you is, I know, of course, you've shared some of your concerns, which I'd like that you talk to us about these concerns. We know the WHO has said that it's possible that we can end HIV/AIDS as a public threat, for humans by 2030. But how visible are the approaches that the WHO and particularly Africans, how visible are these approaches to ending HIV/AIDS by the year 2030?
Based on the results we already have, Nigeria had a high burden of HIV/AIDS patient, high burden of transmission. All the numbers are actually on their way down. We have over 88% of our patients now who are on antiretroviral drug. At the start of this fight in 1991, a very small percentage of that number, less than 10%, had access to drug. Mother-to-child transmission is also on the decrease, although it's still significantly high. So we have made significant progress. And if we are to continue on this path, we need to identify what are the current challenges. And the challenges include things like finances, security, and human resource, especially at a time where our human resource is being depleted by significant exodus of health workers, especially at a time where, due to challenges with the exchange rate or a fiscal situation in the country, funding for medications, which are usually sourced from outside the country, would continue. The cost of medications will continue to rise as the dollar goes up. So these are a few challenges. But the theme this year is that we need to let the communities who are directly affected to lead, because this would give us an advantage of what you call the bottom-up approach. The communities who are directly affected would tell us what their key challenges are and how we can intervene to close some of these gaps that may come up.
That's a good way to end this conversation, at least for now. Vice President, Medical Initiative for Africa, Dr. W.H.O. Thank you so much for joining us on TVC News.